All right. Hey guys, my name is Olivia Goodman. I live in Las Vegas, Nevada, and I am a senior in high school. My mentor was Aya Calavero. I chose this topic because I have always been interested in psychology and the research process, and I wanted to develop a project that would have a positive impact on others. So, my research topic was how do age-appropriate educational interventions affect children's emotional responses to insects? So, in other words, this topic looks at whether educational tools such as a brochure can assist children in managing their phobias of insects. So, phobias are defined as an irrational fear normally linked to specific situations, objects, or concepts. One specific phobia is known as entomophobia, which is the irrational fear of insects. So, some current interventions out there or methods to manage phobias include exposure therapy, which mainly helps with the desensitization, which means to get used to what is being exposed, facilitating a parent's help with managing the child's fear, and affirmation strategies, which is reminding them of what is reality and what is not. Additionally, pharmacotherapy, also referred to drug therapy, is a way to treat phobias through administering medications. However, pharmacotherapy is also linked to drug abuse and reactions. Therefore, establishing this treatment is insufficient for long term therapy suited to phobias. Moreover, substances like glucocorticoids are another intervention and are hormones utilized to reduce memory retrieval and therefore minimize the ability to remember traumatic memories, thereby causing fear reduction. One innovative intervention that is also used for various psychological treatments is bibliotherapy. Bibliotherapy is a therapeutic modality which involves reading certain literature which is useful in aiding personal adjustment. Additionally, bibliotherapy is considered a psychoeducative program. Psychoeducation is shown to have a positive effect on children, and it has been found when given enough education about insects, elementary and high school students have been found to feel significantly lower levels of irrational fear or phobia about insects. So, as you can see in the model to the right, given that the current body of literature showed that the narrative-based interventions such as bibliotherapy and psychoeducative modalities have been successful interventions, we hypothesize that by combining narrative-based interventions and psychoeducation around bug phobias through the utilization of our brochure would decrease anxiety in children. So, in a study by Luke Gibb and colleagues in 2012, using a psychoeducative program with 8 and 9-year-old children that had fear of spiders were found to have a fear reduction after the children underwent a psychoeducative program. However, this line of research was only done on spiders, thus there is a gap in the research regarding psychoeducative programs on other types of fears. This current study utilized a variety of bugs preserved and alive. So further, there is a gap in the literature as it relates to how narrative-based psychoeducative programs would assist children with entomophobia, the fear of bugs. So, as a result, this gap has informed the present study in which we provide a brochure-based intervention rooted in narrative-based frameworks such as bibliotherapy to minimize feelings of anxiety when children are exposed to bugs. Thus, the brochure I created has developed and utilized in this current investigation serves as a form of education. So this study was conducted at the Las Vegas Science and Natural History Museum. There were 20 total participants ranging from 6 to 12 years old and were all either local or tourist children who were living or were visiting Las Vegas. Following this initial exposure, the participants were to complete a brief survey designed to assess their emotional responses, particularly anxiety levels. These surveys were adapted from the Likert scale formats to GAD-7 and the Spence Children Anxiety Scale, also known as the SCAS Child. These scales range from 0, meaning not at all, to 3, meaning always for the beginning assessment, and 0, meaning not at all, to 3, meaning extremely, which was used before the brochure and after the brochure exposure. As a part of the surveys, participants were also asked to answer 4 open-ended questions. So, an example of this would be asking the child, how do you feel right now? Do you feel nervous, anxious, or on edge? In which they can answer 0, meaning not at all, 1, meaning little, 2, meaning a lot, and 3, meaning always. So, as you can see, these are actual scales used in the study, the GAD-7 and the BASC, which is the bug anxiety scale for children. It is child-friendly and easy to follow, and this was all drawn and created by me. So additionally, the children were also presented with an educational intervention in the form of a brochure between the first and second exposure. This material provided age-appropriate information intended to reduce fear and increase understanding of insects. So the children were encouraged to engage with the material by listening and sharing their thoughts. After reading the brochure to them, a second round of the exposure to the insect stimuli followed, during which the children's responses were again recorded using the BASC survey. So, as aforementioned, the GAD baseline questionnaire was given before any exposure to the insects, and on average, the GAD baseline score was 2.7 out of 420. And after the subjects were first shown the bugs, the average anxiety score rose to 6.2 out of 420. However, after reading the brochure to the children, the anxiety score decreased significantly at a total of 1.7 out of 420, which was even lower than the initial baseline anxiety score. So, the main themes that were shown in the open-ended responses to the first question were that the participants either answered yes or no to being afraid of insects. And while there were many mixed responses to the second question, meaning which was how do you feel when you see an insect, like being weirded out or saying it depends on on the insect, the overarching theme that we found was that kids did answer that they were scared when they saw an insect typically. And after the intervention and the exposure, the questions that were asked include, how do you feel about bugs now, and what would you do differently if you saw the bugs again? And for the first question, the children mainly said that they felt better about seeing the insects after having the brochure read to them. And for the second question, the children mainly said that they would remember something that was stated in the brochure, as such as remembering to breathe or remember what the brochure demonstrated. Additionally, some subjects even verbally said that the brochure helped them. So, in conclusion, the narrative-based brochure intervention had a meaningful impact on children through teaching them coping mechanisms that they can use and remember for life. And one likely reason for these improvements in anxiety scores is that the brochure provided clear, relatable, and age-appropriate information to the youth. This information potentially reframed their perception of insects and how to manage their emotions when faced with them. So there were some limitations, and as aforementioned, the participants were recruited at the Las Vegas Science and Natural History Museum, which could have meant that the participants may have demonstrated interest, given the nature of the museum, that they already have some sort of baseline interest in the realm that the museum covers, which the museum does include a bug exhibit. And some children had a natural curiosity in bugs while also being a bit cautious about them, as they told me. There was also a high probability that no child that was a participant in the study actually had a severe phobia of bugs. For example, one child was more interested in bugs, but he was terrified of heights. Thus, the content of the brochure had to be specified and adapted to make it apply to other fears. Furthermore, there is a chance that the participants could have been untruthful about their answers just to look more resilient to fear, while other children may have just told the investigator what they wanted to hear, as children can be very impressionable. So, where do we go from here? Further research needs to be done by utilizing a comparative methodology with children who both do and do not have phobias of insects, rather than those who are just mildly scared or curious about them. Additionally, while our intervention proved to be beneficial on these 20 participants as it proved to decrease their anxiety levels, further research needs to be done with a large sample size for generalizability. These are my references, and thank you.
Thank you, Olivia, for that presentation.
Yeah.
I do have a couple questions. So we obviously are talking about insect phobia, but I'm curious if in your research, did you hear about any other common phobias that you think might be able to be tackled with this approach?
Oh yeah, definitely. There was I can't remember the scientific name, but there was a fear of throwing up. That could be definitely this brochure intervention can be used to apply to that. And like I said previously, the brochure, and I'm gonna go back to that slide really quick. These different methods, such as like taking a deep breath or just looking and reminding yourself that these fears are more scary than they seem, they can be applied to any phobias, any fears that you have, and even anxiety in general. So,
I'm so glad that you came back to this slide because that brings me to my next question. I love that you combined, obviously, your interest in psychology with your obvious talent in
yes.
art. So are you planning to do more of this? What's in your future?
Definitely. Yeah, I want to go into something with animation and psychology. I think using both my passions would definitely benefit some people, such as, making psychoeducative films for managing their fears, things like that. Maybe I can even use the character I made in the future. His name is Bugsy, by the way. Yeah.
Bugsy, I love it. So cool. Well, this is a super innovative project. Thank you so much for sharing it with
Yeah.
us.